Excellent.
Oh, we'll just probably get started here. We might have some more folks join us as we continue on. But today we've got Professor Stevens with us. He's here to talk to us about careers, IT careers in healthcare. So he'll kind of get into, and I'll ask him questions about his history and his background. For those of you who've been on some of our other coffee chats this earlier in the week, we try to follow kind of a format of we want to hear history, some career advice. We want to hear, some tangible real world experience and recommendations. So that's where we're really fortunate to have Professor Stevens with us. Just given his history, what he teaches at UTD, the places that he's been, the knowledge that he has. So really just take notes here. And our hope is that you would leave this session and others this week with some action items for yourself. Maybe a follow-up step. Maybe it's an article to read, a resource to check out. So really, we just ask that you use this time. Please ask questions. We had some students who submitted questions last week, and so we'll use some of those to frame the conversation here. But really, Professor Stevens has a fantastic presentation here to show you. Chime in, either raise your hand, put a question in the chat if you have it. We'll just kind of go from here. And also, if you'd like to show yourself on video, we would love to see more smiling faces. And so I guess just to get started, we'll ask Professor Stevens if you can just talk to us a little bit about really where, from the beginning, where you went to college, what degrees did you get, and then why did you decide to get into healthcare? We'd also like to know what your first job was out of college. So maybe if you can start with your background, that'd be great.
That's kind of interesting. Okay, I'm going to also, can you see the start of my slide presentation as well?
Yep, looks good.
Okay. Well, I'll kind of follow the script. Welcome again. My name is Tim Stevens. I've been a full-time professor. This is my second year. Is that before I was an adjunct for 3 or 4 years, so I've been around for a while. And where's my family background and that sort of thing? I grew up in just a teeny weeny little town in Central Texas called Bangs, Texas. And yes, you can give me as much grief about that town name as possible. But my father was a physician. And he did everything. He was a family practice guy. He was an orthopedist. He was he was in the International College of Surgeons. And in a small town like that, you do everything. And one of my brothers has been a physician, and my daughter is a physician in San Antonio. She's finishing up her residency and is getting ready to start a fellowship, but she's family practice and OB. Quite frankly, I thought seriously about going into medicine myself, but chose business and management instead. My studies, SMU, biomedical engineering, and my graduate studies were at University of North Texas. Have an MBA in management science, and it's kind of interesting. It's a challenge, and I think all of you will agree about trying to decide what your career is going to be whenever you're in your mid-20s. Heck, you're just now starting to figure out who you are and what your aptitudes are and those kinds of things as well. But eventually where I ended up was that, okay, I have all of this medical background, a scientific background, a business background, and I figured out that my niche is where all of these three major areas all kind of intersect. Both from I scrubbed for a thoracic surgeon one summer. I drew blood for the lab. I worked my way through college at Presby, I was one of those nappy little people who come around and knock on your door and say, "I'm here for some blood today," and that's just not a very pleasant thing for a lot of people to have somebody come in and draw your blood. But um, it gave me that experience and that exposure from that whole insider. Um, Inside the caregiving of the hospital, that compared with with my dad, he did it all. And so a lot of Sundays we would be in his office either stitching somebody up or putting a cast on or something. And so I was always helping there as well. So healthcare is always this thing that through runs through my veins. But again, it was from an aptitude standpoint, where all of these things kind of intermix and intermingle. Engineering, business, healthcare, and IT. Um, and as my career progressed, I found that, I may not use all of these different aptitudes all at once, but they all seem to kind of bubble up. Even the engineering thing kind of bubbles up every now and then, either a teaching subject or something along those lines as well. So, my early years, my first job out of college, out of undergrad college, um, I actually worked for a power company for a couple of years in Waco. It was interesting because I had the med school application things going on, and I had interviews, and at the same time, here I am working for a power company. What in the world does that have to do with it? Um, with my engineering background, I was the instrumentation guy, and quite frankly, the only difference was the size of the wires and the size of the voltage between a nerve and a power line. So it's amazing how some of these things can all kind of come together. But I went back to grad school, and my first job out of graduate school, I worked for a company called Rubicon. Rubicon did laboratory information systems, and these were the early days of computerized labs, where they managed the orders, they reported the results. There was a lot of, and it wasn't online, for instance. So everything was all geared around, well, how well can we print our laboratory results on a piece of paper? Of course, hey, now it's all online and available to the patients as well with electronic medical records. But back then, it was all about um, doing the work and creating the paper. But I was a mumps programmer. Did that in the early years. Then my career took a little bit of a turn. I went to work for Baylor. Back then, it was Baylor Healthcare System. First job there was a project manager role, implementing the patient accounting system. And again, it was all about creating paper. They had, electronic claims had just come onto the scene, and so luckily, I was the last of a string of three project managers for that project, and luckily I was the last one, and it was successful on that. And as a result of that, I was promoted from that project manager role to they gave I we all had there were several information systems managers. It's kind of funny to see the whatever we want to call it, the inflation, the title inflation. So we had the CIO was basically a director, and then his direct reports were all managers back then. But basically, I had the IT responsibility that was everything but the main Baylor hospital downtown. And the reason I bring this up because it's so key, um, in that Baylor has a for-profit entity, has a construction company, It had a 300,000 visit a year home care agency. There was a home infusion therapy area. Um, the foundation, the money raising arm of Baylor was under my purview as well from the IT standpoint. And at that time, they were just starting to affiliate other hospitals. Garland, there was another one in Ennis, so they were just trying to figure out how to mold all of these things together. And hopefully, you're starting to see a common denominator of the things that, quite frankly, from my career standpoint, I was always trying to connect dots. And the final one came whenever we created the physician organization called Health Texas Provider Network, which still exists today. And that is Baylor's contracting arm, but it's also the physician network as well. UT Southwestern has a similar plan with their faculty physicians, but that was a big deal, big change for Baylor. Um, After Baylor, it was a 12 year career at Baylor. I joined a consulting firm. Yet again, it was more of this: how can I broaden what my interests were, what my knowledge was, and so CSC was huge. I mean, it was 50 or 60,000 consultants, and so I had to kind of start focusing in a little bit more of my expertise, and I became the ERP guy. Did a lot of IT strategy and those kinds of things, but primarily ERP implementation. Um, um, the consulting world was important because it started expanding not necessarily the base of knowledge, but you started expanding your reach in terms of specific healthcare institutions as well. Okay, so that was my first exposure down to MD Anderson, and we'll see MD Anderson appear again here shortly, but also other health systems around to where you could see how different health systems would actually operate. So you'll see through all of my career, I've been kind of focused in on the provider part, but there's more to it. Um, let's roll the clock ahead another 4 or 5 years. My first boss at Rubicon, his name was Kirk Kirksey, ended up being the CIO at UT Southwestern, and I get a call from Kirk. Says, Kirk, hey, Tim, come and be the ERP guy for me. Can you please? And don't you want to see your kids grow up? I said, sure. So that started an 8 year career at UT Southwestern. And Southwestern took advantage of my consulting background because that was whenever we sort of changed directions. We brought in hospitals, and they had figured out that I had merged hospitals before in my previous consulting career too. Um, I was at UT Southwestern for 8 years. Decided to go back out on the consulting road and start my own consulting practice. Ended up being at UT Southwest, I mean, at MD Anderson down in Houston for 3 years. They'd asked me to step in and be interim almost everything, which ended up being very, very uh, beneficial for them and for myself, but it is in Houston. And eventually we kind of had to say, okay, you're in Houston. I'm not going to come down to Houston anymore. But anyway, it was fascinating. Love the people. Um, I was, they didn't have a CIO at the time. And so we brought a new guy in. I also served as the interim executive director then in IT, but also um, we did a strategic plan there as well. And so it was totally fascinating work to do at MD Anderson. And then I also did some work with a private equity firm that they were trying to build a whole portfolio of technologies around um, clinical decision support and those kinds of things as well, which was and some acquisitions and ran some little companies, and also um, we dispersed some little companies as well. The last one that I did was at Cedar Sinai, and it was a lot like MD Anderson. They asked me to come in and step as an interim management exec kinds of things as well. And so that leads me to here. And so hopefully the whole point of me being here, it's hopefully can I, and for those of you who have had my classes, I do like to focus on the practical side of the world. Um, and so I teach two primarily healthcare. I teach a couple of undergrad classes, but my healthcare graduate classes, I teach the healthcare supply chain class. Um, and I teach our electronic medical records class, and which is focused in on Epic. But we also, in that class, go through the business processes behind the system as well. We do that in conjunction with UT Southwestern. The healthcare supply chain class, again, is a little bit more focused in on the practical side of it. So we teach some negotiation skills and those kinds of things, as well as some analytical skills. But the healthcare supply chain is so absolutely specific, and there's so many little nuances about it. Those are the kinds of things that we focus in on to prepare you for that management and analyst role inside. Primarily, I'm focused more in on the provider space for that side, but certainly, have a practical side on that front. So I thought I would give you a little bit of advice, and this kind of addresses some of the questions that some of you have submitted so far. And oh, by the way, you're welcome to start asking questions as well. But as you can probably see, I've been in care pretty much my entire career. It's a tough nut to crack, quite frankly. It's a small, tight community. It seems like everybody seems to know each other, or you're only 1 degree of separation apart. And so once you get in, you have some sort of a reference or some sort of experience that is referenceable. That opens up a whole lot of doors. But being a new person, just straight out of grad school, pretty tough nut to crack. And so because of that, you have to start really kind of working your contacts and those kinds of things. We have at UTD, we have these fabulous folks like Dr. Barrett and Dr. Thurgood. That are so connected. I encourage you to take full advantage of those connections as well, because they are really, really connected. Some of my direct connections are starting to fade a little bit, but still, that's another thing. As you work through these different areas with your connections, it's just one door that opens up after another. So, my first bit of advice to you is to identify those connections that are inside the community and take full advantage of them as well. We have Don Taylor, who is on the call as well. Just incredibly connected with the community out there as well. So identify those areas, milk those connections for as much as you can get. The other thing is that if you've noticed throughout my career, personally, I wanted to broaden up as much as I could, not only just from the provider space, but especially in academic medical centers such as UT Southwestern and even MD Anderson. Um, it requires a broad knowledge, not only just from the clinical standpoint, but from the business standpoint as well. And then the third thing that you really don't it really doesn't come to mind very much, but the whole research arm, um, both, and especially with our two um, um, academic medical centers. I mean, UT Southwestern, shoot, they do as much basic research as probably anybody in the country. And those kinds of things, it's close to $1 billion a year. Who would have thought? That's an enormous amount of basic research. MD Anderson, they do more clinical trials than anybody else in the galaxy. It's and so managing that, it takes some special expertise, financial management, and those kinds of things. How are you going to manage your grants, um, um, and those kinds of things? So that's why I'm saying it really does require, especially from the IT standpoint, a broad base of knowledge. Now we'll talk about some of the different kinds of positions that you may want to think about. But there, not only do we have the providers, and I'm talking about the clinics and the hospitals and those kinds of things, but think about other kinds of other vertical businesses that would be considered as health. The payers, you have a whole set of complexities around being paid, right? And so the IT has an integral part of that business process so you need to know the difference between a copay and co-insurance, and how all of these different kinds of things apply. And you're basically connecting computers together and managing the protocols and those kinds of things as well. Other kinds of business partners, you have your suppliers, you have things like GPOs that I would consider as a healthcare IT kind of an approach as well. Pharmaceuticals, that's a whole different world. And so I see some opportunities in that space. And even the software vendors. I see a lot less um, technical development that happens inside the provider space, but a lot of this new development is coming from the software developers. And, quite frankly, some of them are kind of dropping out. For example, ERP systems, it's all in the cloud. And so these companies like Oracle, PeopleSoft, um, SAP, they're making cloud offerings. And guess what? There is less and less customization for those kinds of things. They're basically turning ERP into a commodity. Even very sophisticated EMR vendors like Epic, um, very, very few customizations. And that's actually what makes Epic so successful, is that they are very prescriptive about what you have available to you and how you use it. Now it's highly configurable, but very little mumps or SQL kinds of programming and those kinds of things as well.
Hey, Tim, can I
Uh,
just interrupt you real quickly? So,
you sure can.
so many things you've just described just in these last few minutes. Where, and maybe you'll talk about this in a little bit, but where can students go to learn what does some of that mean? Are there classes you suggest, or are there websites they can go to if they're just dabbling, trying to consider if they were wanting to kind of go in this path, how they can educate themselves more on what some of that means?
Well, my favorite one is our own analytics class, our own healthcare data and analytics class, and also I think from the introduction classes that we have too. Um, and I'm not exactly who teaches Kirk's old class. I don't who teaches the analytics class now.
So we've got Professor Mark and then Professor Mehmet.
Yeah,
Ivachi.
and and Mehmet's classes, he has an online class as well as in-person classes. And I audited his online class, which is absolutely fabulous. And by the way, on some of these touch points, we make sure and touch with some of the other professors so that we aren't stepping on each other or unnecessarily duplicating. Um, for instance, in our accounting class, I do teach as part of the healthcare supply chain. You know, it's such a huge part of the hospital's expense, and so we do go through a lot of the accounting and financial processes that go along with the supply chain specifically. And by the way, I do teach part of that is we go through about what's an encumbrance and how to deal with that special kind of bookkeeping that goes along with some grants and those kinds of things. Um, Accounting classes usually don't cover that very much because there are what, one or two questions on the CPA exam about that and about government accounting standards. Um, and so I definitely suggest taking Mehmet's class. Definitely, it's he's great instructor, and the material is great as well, and it gives you a lot more of a broad view. Um, and I try to introduce some of those as well in my own classes as well. Um, the EMR class, you know, yes, it's focused in on Epic, but we address those different kinds of processes that go on, the admissions and registration kinds of things. Um, from the billing standpoint, how do we generate charges from all of these different kinds of things as well? So, um, I try to give it a lot more of a broad stroke with that EMR class. It's more than just hands-on Epic. So, and
And that one,
then,
just for the folks on the call here, we do have some undergrads who maybe wouldn't be familiar with that class. So I think what Professor Stevens is talking about is it's a graduate level class,
mhm,
but there are also undergraduate level classes as well. So if you've got questions about those, feel free to reach out to
I-
me, to Ray Woodcock, who's on the call too, uh, Keith Thurgood, who's the program director for the graduate program, and then Britt Barrett, who's the undergrad program director.
right,
Anyway, if you
right,
just to jump in, if you have questions
and
about those classes. Yeah.
right, and I think Britt teaches the introductory and the capstone as well. So, um, anything that you can do because there's so many different areas within healthcare IT. I mean, it's just not, oh, I'm healthcare IT. That really doesn't mean a whole lot just in and of itself, because there are so many different facets, so many different kinds of businesses and related businesses. So as we go through this, um, I think my last piece of advice is the learning never stops. Um, there are constant technological advances. Um, just things like virtual reality and what that is doing to the operating room. I mean, I've seen where people actually practice a very delicate surgical procedure in virtual reality, and these people are halfway across the nation from each other. And if it's a very delicate kind of procedure, then they can get on get on with each other and actually practice the procedure before you actually do it. That's just one example of one of the technological advances that we have. Um, keep I, Subscribe to the Wall Street. Subscribe to. I definitely suggest that you join ACHE, whether you're a graduate student or you're an undergraduate. Take advantage of these professional organizations, and if you're interested in IT, definitely join HIMSS, HIMSS. I think we have student. I don't think it costs anything to do that. Um, I'm a member of it as a good networking kind of an approach, but that also We're kind of in the COVID mode at the moment, but they have great sessions to where you can actually keep up with the technological advances. What a great way to do that. You're meeting people, even though it's kind of virtually at the moment. You're seeing what kind of vendors and software are out there as well. So HIMSS is a fabulous organization from the IT standpoint. But take advantage of, especially while you're a student, um, to join these professional organizations whenever you can. Why is that? Guess what? You are making sure and expanding your network of who you know, who you can call on, who you may be able to help you get connected with a particular company or those kinds of things as well. Keep up with the current events. One thing that COVID has provided us is a wealth of case material. Yes, we have all of that, but that means that, and it's fascinating to watch how research, the whole process is accelerated. And guess what? It's going to continue that way. In telemedicine, we it really accelerated as a result of the lockdown. But guess what? Telemedicine's here to stay, and it is going to change how we do things from now on. My other tips here are look for practical experience anywhere you can get it. I like, quite frankly, project management because if you're managing an IT project or a healthcare inside of healthcare, you're not necessarily doing writing programs and those kinds of things, but you have to know something about the content that you're managing. And this forces the issue of you learning those processes and those kinds of things. And so I think that is always a great lead in into that. The other
And
thing is,
can I ask you a quick
yes,
question about project management? So
sure.
that has been a theme that's gotten brought up this last week as well. Others have suggested that. And so I've gotten some follow-up emails from students who've said, "What does that mean?" Or can you help me understand where I go for that? Specifically, these were undergraduate students, but can you talk a little bit about what you mean by project management and kind of where they can go for more information about that?
Okay. First of all, project management. Let's talk about what a project really is, and especially from an IT standpoint. Um, IT is typically um, charged with responsibility of, for instance, an implementation project. And typically these are done in IT. Why is IT brought in as kind of the the central point for managing these projects? Well, because you have technology that is a component of everything that you do. So typically, then, if you have, and I'm going to continue with my example of an a system implementation project. Um, you, as a project manager, you are responsible for not only connecting what all everybody has to do, who are your resources, what are the tasks that are involved in that. There's typically a budget that's involved as well. And so you're starting to interact with all of the stakeholders of the project that you are managing. And by stakeholders, um, typically you're dealing with department directors, clinicians, certainly the financial folks as well. And your responsibility as a project manager is to manage the resources, who's doing what and when. So there's this management kind of component to it, but you're also managing budgets and you're also managing the tasks. And I will contend that if you don't know what these tasks, what they are delivering, and it's more than just yes, did you do it or not, but is it successfully done? And these tasks all involve processes. All right. So as a project manager, yeah, you're doing the project management kinds of things, but you're also learning the content of the project that you are actually managing. Quincy, did that answer that question for you?
Yeah, that's great. And if
Ex
anybody on the call has a follow-up to that, or after Professor Stevens is done, if you want more information, please stick a question or follow-up in the chat.
yeah,
Thanks.
I'm happy to talk at length about that. Um, Finally, the other thing is you may not find your dream job right out of college. It may take you a while, um, but be flexible about the positions that you do accept. Um, Consulting, for example, it's probably going to involve some travel, but on the other hand, as we'll see in just a few minutes, consulting provides you a very broad base of the things that you learn and the connections that you make. On the other hand, be very, very careful that you don't get stuck into it or paint yourself into a corner. Um, yeah, so I think it's pretty important to maybe try to figure out, okay, what is my ultimate goal? Well, you're still early in your career, so be flexible enough to try to figure out, okay, we have so many of these different kinds of businesses and those kinds of things. Start early. So yeah, this is I've got a real interest in this, but yeah, I'm not real interested in that. But I need to have some sort of knowledge base in order to get to where I need to go. Okay, so be very, very flexible, which also means yeah, don't get stuck. Okay, any questions so far? What I was going to do is present some different kinds of roles that you may see out there, and maybe discuss a little bit more about them as well. So here's a sampling of some roles. Um, First of all, IT, you say, well, that's a techie kind of role. I'm really not kind of interested in that. You know what, guys? IT very seldom now involves sitting down and being a heads down programmer. Those days are gone if you're working in for a provider. On the other hand, you have uh, you have to deal with database kinds of issues, and so yes, that is a technical kind of role. A lot of times, you have a database that is sitting underneath um, more of a presentation layer, and so you're looking to speed things up. You're working with the analysis folks to say, okay, what data do you need in order to make the kinds of inferences and recommendations that you are trying to make from the analytical standpoint? So you have this sort of interaction between the database administration and system analysis, but then you also have this, you're working with the analytics. Um, let's see, I think one of the terms that you may hear is data scientist, which is an absolutely vital role in terms of knowing what data that you have, what is the source of that data, was the source of truth for that data. And you're always challenged, and especially these days, whenever you have so many different systems that are all interacting with each other, is to make sure that whatever data that you have, and if you have happen to be lucky enough to have a data warehouse, what does all of that mean? Where does it come from? So that you can always have the right um, the right data definitions, the timeliness, and those kinds of things as well. The other thing that we don't talk too much about, and you don't think about too much in terms of the healthcare IT roles, is the non-computer kinds of things. And so that's where the biomedical engineering kinds of aspects come into play. What are the requirements of the equipment? There's an enormous amount of this stuff going along. Um, what are the physical and electrical requirements if you go and buy an MRI machine? Or if you are in the cancer space, if do you have a particle accelerator? Well, if that's the case, what are the engineering requirements around those kinds of things as well? Doesn't have anything to do with the computer side of the world or the programming side of the world, but certainly from that whole biomedical engineering kind of aspect. Okay. Um, Other kinds of IT roles. What we see is more and more of the pure programming kinds of things, the coding, the writing of programs is done more and more by the software vendors. So we see more and more responsibility, especially with ERP systems, with the EMR systems, a lot more focus on the analyst role.
So
And
can I
by
jump in? Can I jump in
yes,
here real quick? So there's a question from a student, and this came up in our poll last week as well. But are there specific areas? Is there software that students should learn? If they don't have experience, should they? Where can they get it? And for entry level jobs in these areas, like you're talking about, what should students be focusing on now while they're in school, getting the education?
um, that's a good question. And if you're looking to get into, okay, well, first of all, the description of a business analyst or a clinical analyst is that you are responsible for understanding the processes that go on and how your computer system best fits those, and how is that going to work. I would suggest several different areas in that one. First of all, you could look at there are several major computer system vendors that are out there, like Epic. Epic um, does employ entry level folks to come and be their implementation folks. They're junior level, but it's fascinating because then you get to see how different providers work, and also understand um, how the computer system becomes a tool to manage those. The reason I bring up Epic, because there's this whole training program that they go through. You get to go spend some quality time in Wisconsin. Uh, and they train you about the system. You become certified in the system, but you also get to be directly involved with the implementation in their individual clients. The same thing can be held with consulting companies. um, Typically you have a that would be your implementation partner. um, a vendor such as Epic would know their own software, but the reason that you would have a consulting partner from a provider standpoint, you would have somebody to come in and help you do that. Um, there are other things other than system issues that you have to deal with. There are internal cultural kinds of issues, change management, um, training issues, and those kinds of things that come to play. And so this customer facing, can you step into a provider space and go straight into that? Rarely, but it does happen. And in fact, one of our students, one of our EMR students, went to work at Southwestern in their training area. Um, yeah, and so basically what happened is that, okay, I get a little dabbling of that, and but your employer is going to provide those kinds of tools as well. So where are you going to get that kind of expertise? Well, first of all, uh, do well in your process, and and this is where Mehmet's class is kind of neat, because it gives you an overview of some of these critical business processes. And like I said, and that's on the graduate side, but um, you also, as on the undergraduate side, we have these other classes like 3300 where you actually go through and process, you map your business processes. Um, that's a great place to get exposed to all of these different kinds of things. Whether you're a healthcare person or not, that class like ITSS 3300 is a very, very good broad stroke on that as well. So that just happens to be another class that I teach. In fact, I'm the coordinator for that one. So, and we only have about 15 to 18 sections of that every year, every semester. It is one of those prerequisites. I strongly urge you to get involved into that as well. We have some fantastic instructors for that. So, do well with those. And again, early in your, whether you're a graduate or undergraduate career, make those connections with your instructors. Most of us have all come from practice out there. And so, um, I love having people come and visit and revisit. Okay. So, Quincy, does that answer your question about how do
Yeah,
you get started?
that's
Okay.
great. And there are some other questions kind of related to outside of classes. So is there experience that you would recommend to students that they should try to get now to build their, you know, knowledge base
Mhm.
outside of classes
Well,
as while they're in school?
first of all, interns. It, I am a huge proponent of intern kinds of positions if you can find them. And even during the summertime, especially for you undergrads, um, take full advantage of summer jobs. Like I say, you don't have to be really, really, you don't have to be proud about what you do. But look for temporary summer activities, especially since you're dealing with healthcare. Um, Go see if you can find some temporary work in a hospital or a clinic or something along those lines. Um, Take full advantage of those capabilities. I, you learn a whole lot just by being in the same proximity. How does this clinic work? Well, I mean, you can be a temporary person just keying in information in a doctor's office. Um, a lot of medical students actually, they take a temporary job as a scribe. Maybe they're having a gap year or something along those lines, but look for those temporary kinds of things if you can find it. And also, I know we're always pressuring our students to go find a good internship. And us as faculty members, we're constantly, beating the bushes for those kinds of opportunities as well. I know I do. Um, there are all kinds of those kinds of opportunities, and I think you're going to see an increase in the number of kinds of research projects that we have available too. Anytime that you have the ability to do that, um, to certainly take full advantage of it. Don't let your summers pass with you sitting in a lounger and watching TV all summer. Does that help?
Good
Sorry.
advice.
All right. Yeah, the other thing is that as we go through these different kinds of roles, um, we had the customer facing, training roles and those kind. Training is a great bell ringer because, and in fact, the way whenever I was managing an IT department in a hospital, most of the time um, I would make a deal with my customer departments, and some of their staff would come and be in my area for about 6 months. My staff would go and be in their department. And so, number one, that helps. If somebody quits or leaves or the department is stuck because there's not enough people, they had a sudden departure or something along those lines. Some of my people could actually step into that role, and give them some backup on that. The other thing is that it gave the departmental people a lot better idea of what goes on from the technical standpoint, and it also gave the technical people a lot better idea about the inner workings of their customer departments as well. So that was just my style of line management on that front. But it also kind of gives you a lead in on budgets and those kinds of things as well. Um, so you have your sort of mid-level management, and then of course you have your upper level management as well from an administrative and exec kinds of standpoint. I separate from the IT standpoint, I separate these two. One of them is more operations. You're dealing with huge budgets. Yeah, none of this technology is cheap. And so, um, and it's real hard to fund. I mean, it's not like you can go say, well, I'm going to have the McDermott Memorial EMR system. That just doesn't happen. You put people's names on buildings and those kinds of things, but these are infrastructure kinds of things. They're really hard to fund. They're hard to get. They're hard to get approval for. Um, they're not very popular sometimes. For example, at MD Anderson, you know what our total capital budget was? Is $500 million. Hell, I can run Greece for a couple of years on 500 million bucks. But um, basically, what it involved is not only the software costs, but the backfill for all of these people who are going to be involved in the implementation, the management of it, the physician time in order to teach the system to do different things. That's an enormous amount of money. It also said, well, it could impact our revenue stream, and so we have to pack away some cash just in case there's a disruption. So that's the operational side. On the other hand, you have the strategic side from the CIO standpoint. How what direction are we going? And so you have to, back to my first slide, or the third slide actually, you have to be on the forefront of what's happening out there, what are the new developments, and how you, let's connect that with the strategic direction of the organization. That's where the CIO comes into play, and it's a very strategic role. And typically those roles are separated from the office of the CIO versus the CIO itself. The CIO is more of a strategic directional, as you're trying to figure out the whys, as opposed to administrative and operations. That's the what's, the who's, the how's, and the when's, and those kinds of things. There are two areas also that I kind of wanted to talk to you about. A lead in into this is, and quite frankly, there are lots of consulting firms out there. And some consulting firms rely on a stream of entry level folks um, to 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 provide the support, and eventually you become a subject matter expert. But you've got all different kinds of areas that you can kind of focus in on. Well, system implementation, we've talked a lot about that, but other things like supply chain. Why is supply chain so important? Well, it is typically either the greatest cost to a healthcare institution or the second greatest cost. It's either number one or number two. The people cost is the other side of that. But managing the supply chain is absolutely vital, and it's always under improvement. It's like, and by that also include things like the operating room and those kinds of things as well. You're always looking for ways to save money, but you do it in the context of patient care. Rev cycle is another area. You're always looking for ways to improve your collections, negotiations with payers, and those kinds of things as well. Analytics is huge. It is absolutely huge. And so, any of our data analytics classes, whether they're the healthcare side or not, um, are really good because they teach you specifics about data and what kind of inferences are you going to make from them, and how are you going to communicate your recommendations and those kinds of things. This
I,
is this is
I
very typical for consulting. Yes.
I have a really quick question. So there was a question in the chat, and I think this is a good spot to ask it, which is, okay, if you're taking those classes and you're learning something in an analytics course, how do you note that on your resume? So let's say maybe students don't have the degree yet, they don't have a certification, but they want to show what they know. How would they do that from something like this on their
Oh,
resume?
that's an excellent question too. First of all, and depending on what the structure of your resume is, I like to have highlights in my first page of my resume, or if you go look at my CV, there are, the first page is nothing but bullet items. And recognizing with the analytics, make sure if somebody's looking for you to be an analytics kind of person, use those keywords right up front. You know, we always deal with what kinds of analytics are there. There's predictive, which is a hot item. So make sure and make those words very prominent right at the beginning. Use your predictive, your prescriptive, and your descriptive analytics. Use those, very prominently and know what you're talking about too whenever it comes time for being able to communicate those analytic skills. I think the other thing that the resume is one thing. Being able to communicate what those capabilities are. Have we talked about elevator speech yet?
Not yet. I think the
Nah.
CMC talks about it, but mhm.
Okay. Well, an elevator speech is basically you've got 15 seconds to convey you, to sell you. And so if especially if you're in the analytics space, make sure that that word shows up somewhere. And that will perk up will catch people's attention for sure. But be able to, you know, not just don't use the word analytics in your literature. What kind of analytics? Predictive. That's a great that's a great bell ringer to tickle some interest on that front. Okay.
So
Sorry,
just real
that's
quick, so we're about at our time, but we can stay on. I don't know if Professor Stevens, if you have a few extra minutes
I
to
do.
answer some of these questions. Okay.
I do.
Thank you so much. Thank you.
Um,
So, yeah,
can
okay.
I kill my PowerPoint presentation? I'll just kind of look over here at the messages that are coming through as well.
Thank you, Dr. Shivas. That was an excellent presentation. I have a quick question. Will you be teaching HMGD 6325 next semester?
I will.
I heard great things. I heard great
Oh,
things about that course, and I'm looking forward to
flattery
that.
gets you absolutely everywhere. You immediately already went from a B plus to an A minus, right? No, I'm kidding. No, we teach that every semester, and we have begun teaching 6327, the EMR class, every semester as well.
I heard about that in 6323 with Dr. Awaji. He's, like you mentioned, he's an excellent professor too.
Oh yeah, yeah, yeah. He's one of my favorite people. I have a lot of favorite people.
Thank you, Dr.
Okay,
Stevens. I
well, I look
appreciate it.
forward to seeing you in my class.
Same here.
Um, let's see. Here's one for the outlook for the healthcare informatics industry. Um, I think it's actually going to explode or continue to explode. Why is that? Because and by informatics, I'm talking about it's more than just the analytics side, but it's the gathering of all the information, the data that you're going to be using as well. And we are a data-driven society, and the ability to collect data is just going to expand. Well, your job as the informatics person and the analytics person is to try to filter through all of this stuff, and what's the stuff that we can actually use. And the other thing that's going to help are all these intelligent techniques, the artificial intelligence and those kinds of things, because we have all of this data. How are you going to sift through all of it to make sense of it? And so we're going to be relying more and more on different kinds of intelligent techniques to actually be able to get to a point where we can make these data-driven, objective kinds of decisions. Okay, so that was that one. Let's go look at Paula. Okay, Paula, and you guys can. I'm on Teams, and so if I'm not teaching, you can call me anytime on that front. Make sure I'm awake. But you're welcome to contact me anytime. To what extent is knowledge in IT needed to work in healthcare IT? That's Avery. That's a really good question. I would consider that you need to have just a fundamental of technical background. But if you notice, there's a lot less focus in on the programming and those kinds of things in the database and the hardcore technical. I throw the business and the clinical analysis into it as well. Why is that? It's typically those analyst positions are in IT or they're associated with IT. And so I think it's just as important that, yes, there needs to be some sort of a technical kind of foundation, but there also has to be that intersection of the business or the clinical processes as well. I think more and more reliance on these analysis analyst kinds of positions, less and less on the pure technical. Why is that? The technical tools are just astounding, but that also means that there's probably less dependence on an army of programmers, so to speak, to get that done, just because the tools are better. And you know, you're from an analyst position, you are establishing, for instance, like in the EMR, the electronic medical records, the analyst position is responsible for making that connection of, okay, what's the process? Okay, how are we going to configure the system to actually do that process? Does that make sense? Avery, that's a great question.
So that kind of leads me. There's a one that a few students have asked, which is, for some commoners on the call, such as me, can you describe the difference between informatics, analytics, and IT? So healthcare, informatics, analytics, and IT.
They're going to be, and Don Taylor's on the call too. He's another good one to answer part of this. But in terms of the IT, I throw a lot of things into information technology as opposed to information systems, and analytics. Let's start with analytics. Analytics is basically turning, you have data available to you, and the challenge is to turn that data, number one, into information that you can use to make data-driven, objective business decisions. And I use the term business rather loosely here because it could be clinical decisions as well. So decision support and those kinds of things. What are the data that you could use in order to create a clinical pathway, so to speak, that is, if a patient has these kinds of symptoms with these kinds of acuity, which care path are we going to choose to do that with? So that is decision support, but that's based on analytics. Now, IT, information technology, that has two parts, right? Information is basically data that's compiled into something that you can use. Raw data, just by itself, is not part of that, but information technology is is the technological component as well, the information systems. But the technology is like the infrastructure, um, the computers, the network, and those kinds of things. And so that's one component. But an information system also consists of your processes and the people that go along with it. So an information system is really the intersection of those. Yeah, you can probably say the informatics is part of that. Informatics is really the science of looking at all of these things together. Yeah, that's the way I interpret that. Um, and it's all about connecting the dots and making sure that you don't have information silos, because that's not in the business that we're in. And especially in healthcare, it is absolutely vital to make sure that you do not have any of these information silos, so to speak. I mean, people's health and their outcomes and those kinds of things rely on having as much information as possible, but there's so much of it you have to be able to get to it. Does that make sense? And so that's how all three of those all kind of spin together.
Thank you.
Sorry, that was a long answer to a
Good. No,
short
that's
question.
great. It comes up all the time every semester. So that's a really good way, I think, for simple minds like me to understand it.
What
There was
else?
another question here. So let's see here. So let's say somebody doesn't have a business background, but they want to get into healthcare management or administration and project manager roles. What type of experience should they try to get now? And then are there classes you recommend, or how can they best spend their time in college to prepare for those roles?
Um, you know, be careful with what I say on this one.
I won't write it down.
Okay, but it's being recorded.
Yeah.
Um, for project management, we do offer both at the undergraduate and graduate level some project management classes, and those culminate in a project management kind of certification. Most of that's done through the Project Management Institute. I'm a member of that. I was actually an early member of it. But just because you have that PMP certification doesn't qualify you and instantly make you the the end all of perfection of project management. But it does give you a lead in into what are the components of being a good project manager. Just don't fall into the trap of, yes, here are all the boxes that you need to check in order to be there. It's very procedure oriented, but our project management classes are actually pretty good. Um, again, a big component, I think, of being a good business analyst or something along those lines is having good skills at um, at documenting and understanding business processes. And so honing your skills on those kinds of things, um, I think is vital, because you're going to use those kinds of processes anytime throughout your career. So whether it's with a tool called Visio or Lucidchart or any of those kinds of things, um, having good skills at analyzing processes, who does what and what's the communication between all of those, I think is an excellent skill to have. And once you have those skills, then whether it's healthcare or any other I mean, heck, you can use manufacturing as an example. Once you are able to analyze and pick apart those kinds of processes, and being able to map them and being able to communicate those to your customers or to your instructors or to anybody who's around you, is certainly just a invaluable skill to have. Okay. I know that's kind of nitpicking on one thing, but being able to analyze and communicate, those two go hand in hand, because I don't care if you're the best analyst, if you got the best data available to you, if you cannot communicate those to those who are asking questions, or to your consulting customers, or those kinds of things, quite frankly, I feel like that you failed the whole project. Okay.
Well, that's been a theme throughout, is communication, the ability to communicate in writing and verbally. So I think to underscore that for these sessions is really important.
Sorry. Sorry, I got distracted just for a second. What were you saying? Let's see. Are there
any other questions you all have?
Well, Jim has one. James Ramsey is one of my former students, and one of the things that we do at the end of our EMR class is that we actually go through and update our resume. This is the capstone of that particular class. Okay, what have we learned? What have we, and how do we communicate that to prospective employers? And so, yep, they're the keywords in the resumes, but actually, you need to make sure and understand. Have your elevator speech ready, and work on it. That's probably my. What are your goals? What are your experiences? What do you want to do? Be able to clearly articulate that. And you'd be surprised at the number of openings that just kind of show up just simply because you happen to run into somebody. Well, I'm looking for a job. Here's what I want to be able to do, and be able to communicate that concisely, because quite frankly, your span of attention of your audience is about this long. And so if you are able to articulate that quickly and concisely, I think you'll be surprised at the number of doors that are going to be open to you just out of a casual conversation. Okay.
Right.
Jim, did I do that justice?
You sure did. And if I could just put a plug in for you, what I put that on. I added that since we did the exercise in the spring on the EMR course. I added a 2-line item on my cover letter, and that did. I mean, it did catch the attention of different employers, and I actually got an internship this summer and I'm still there at Children's Health in the IT department because of, you're now an expert on Epic. I go, well, I'm not exactly an expert, but I have some experience with it, and just the words you suggested we use certainly helped quite a bit, and just it's a hook, and it was enough to get their attention and maybe give me, and it was also fresh, recent experiences, so they like that part as well. So thank you for adding that and making us do that when we probably didn't want to do that at all. So, but thank you.
Okay, good. I've got as much time as you do, or as much time as Quincy wants to give us. So.
Well, I think we've got a couple classes starting in about 15 minutes, so I think it's probably a good time for us to conclude. Thanks again to everybody who's here. Professor Stevens, we just so appreciate your time sharing with us your history. I think there's so much that can be absorbed from that, of looking at the trajectory, how you can prepare yourself from education to experience, making network connections. I think all of that is so important. So we really just appreciate your time. This is great.
Happy to join in. So, and you guys know how to find me. I'm in email, and I'm on Teams most of the time. So if I'm not teaching, I'm happy to join in.
Perfect. All right. Thank you so much. Everybody have a good day.